Today we are here to announce a $1 million grant to the Ruston community for active transportation and healthy living. The city of Ruston has been building biking and walking trails over the last number of years and putting together a really thoughtful plan that will enable just about everybody in the city of Ruston to be able to walk and bike if they should choose to do so. And at the Blue Cross Foundation, we are proud to be investing some dollars to build out extensions to that plan to ensure that even more people from all sorts of communities across Ruston have access to healthy transportation in this community.
Today we're actually having a groundbreaking for Phase 2 of our Rock Island Greenway, and we're also announcing the $1 million grant from the Blue Cross Blue Shield Foundation, which will help us. Our Rock Island Greenway runs north and south. This will add connectors east and west in the south part of our town, which is the area that has the most folks who live below the poverty line. So we're trying to make it to where people without transportation can get on one of our bike corridors or walking trails, be able to get to doctors, to grocery stores, drugstores, schools, connect all of those.
A lot of people in my district are without transportation, and we have to walk from to and for the school and to the doctor, and this would make it easier and a safer route for the constituents in this area.
It's going to run the entire length of the city of Ruston through some of the most impoverished African American communities adjacent to Louisiana Tech, through downtown, and then out into the pastoral setting of the Piney Hills here in North Louisiana. We're also announcing 3 miles of east-west connectors to the Rock Island Greenway, funded by the Blue Cross Blue Shield Foundation of Louisiana. I've been coming to Ruston on and off for the last 15 years. Having lived in a variety of other places on the East Coast and the West Coast, and most recently 10 years in Seattle, I would come back to Ruston, and every time I would look around and I would say to myself, wow, this place is charming, but it hasn't really realized its potential. There's so much work that can be done here. There's so much opportunity here. And my father-in-law finally said, what is this opportunity you keep talking about? Are you going to do something about it, or are you just going to lament the fact that we haven't grown up yet? Are you going to help us grow up? Or are you part of the problem, or are you part of the solution, young man? And I said, duly noted. There's work to do. And so my wife and I have 2 young children. We decided that it was kind of a once-in-a-lifetime opportunity to move to Ruston in order to be near our daughter's great-grandparents. And in doing so, I found myself with a time on my hands and an actual opportunity to help the Ruston community realize this potential that I foresaw. And being an active cyclist, being someone who likes to push my daughters in their stroller or go for bike rides with them, from our house to their school, or from our house to the city park, or to the grocery store, to the library, I was really challenged by the fact that I could not safely do that here in Ruston. And I just saw that as the lowest hanging fruit. It was fruit laying on the ground in terms of this abandoned railroad grade and the ability to relatively easily convert it to a shared use path that would establish direct connectivity for the entire length of the Ruston community. Low income, low access to automobiles in particular neighborhoods. In this particular neighborhood, as many as 20% of the folks do not have regular access to dependable automobile transportation, and thus are challenged in their abilities to get health care, to buy food, to get to work on time. No good, right? All of this, when you add up all those dots, that all results in disease states associated with chronic inactivity. Those disease states contribute ultimately to premature death. I'm not in the business of premature death. I'm in the business of longevity and flourishing and happy and joy, all right? So the good news, this all changes today. We're going to challenge the dominant perspective that biking and walking in Ruston is not safe. How? By building safe and pleasant places to walk and bike. If you build it and we use it, the community will change. And the benefit is universal. It really is. So I thank you all for understanding, having patience. This all takes a lot of money, it takes a lot of hard work, but we're gonna get it done. And in getting it done, thanks to Jackson and his acute math, we are gonna connect 31% of Ruston's households through these 5 miles that we're announcing today. That's 31% in one project, that's huge. And what I mean by connect is put a dedicated active transportation facility within a half a mile of their place of residence. So that within a 2-minute bike ride or a 10-minute walk on a side street, they can get to a dedicated facility for them to safely move outside of the automobile. 31%. And we also capture 55% of the commercial buildings, right? That means that 31% of the community will be able to access the 55% of their, let's just call it, typical destinations because of one project, funded by you all with support from Blue Cross Blue Shield Foundation.
It's a pleasure to be here with you all this evening on, beautiful weather day in Louisiana, which we can all be thankful for, and to announce something that's pretty remarkable and that we're proud to be of support. So, as was mentioned, my name is Michael TIPTON. I'm the president of the Blue Cross and Blue Shield of Louisiana Foundation. And on behalf of our board of directors at the foundation, as well as a number of our colleagues from Blue Cross who are here today, we're proud to be here alongside you guys to announce a pretty substantive grant in support of healthy and active transportation here in the city of Ruston. To lead up to just a bit of background about this grant for us, let me tell you just a tad bit about the foundation. So the Blue Cross and Blue Shield of Louisiana Foundation started 25 years ago as Blue Cross's commitment to making sure that low-income kids had health care insurance. The original name of the foundation was the Caring for Children program, and it ultimately ensured that low-income kids had health care insurance so they could get the health care that they needed. So we evolved our mission to focus on the well-being of the people of Louisiana, and specifically to try and make grants to support the health of Louisiana's kids and the health of Louisiana communities. Over that 25 years, we've done a few things that you all are probably familiar with. The thing we're probably most famous for is a program called the Angel Awards, where we highlight people who go above and beyond in support of Louisiana's kids. We've picked a number of great folks from here in this area, and we'll be announcing more in the years to come. We did a program for many years called Smart Bodies, a gigantic human body that traveled around the state that people may have walked through, that taught kids about healthy eating and active living. We did that in partnership with the LSU Ag Center for many years. Some of you may have seen that. And most recently, you may be familiar with the program we ran called the Challenge for a Healthier Louisiana, that encouraged communities to deal with the fact that Louisiana is one of the most obese states in our country, and yet we know that we can do something about that through healthy eating, through physical activity, and both. There are ways to really move the needle on that. We funded a number of communities here in this area, Ouachita Well over in Monroe, the Live Lively LaSalle group in LaSalle Parish, some work down in Alexandria with CLETA were all things that we funded that were community level efforts to try and improve health. That brings us to today. So coming off of those grants, particularly that last set of grants, the foundation looked around and said, we realize that there are many great community plans across Louisiana that are addressing major health issues. They might not all be directly about obesity, they might be focusing on a number of other health issues. And if there are communities that have put in the time and put in the effort to come together to come up with a collective plan for how they're going to improve health, we are interested in investing our dollars in support of those plans. We call those collective impact grants, and they can be invested up to the tune of about $1 million in supporting community plans to those ends. Roughly a year ago, I was up here visiting for a conference that was in town. Met the mayor at sort of an just happenstance cocktail party and got to understand a bit more about what you all were doing here and trying to encourage active living and active transportation. One conversation led to another and led to another and ultimately led to the grant application that we're here to announce today. So that brings me to this. At the Blue Cross Foundation, we were incredibly impressed by what this Ruston community has put together in terms of the thoughtfulness and specifically focusing on active transportation and the ways that that can lead to stronger health outcomes, that can enable different communities to have access to healthy eating, to education, and to things that we know are just critically important, as well as all the positive side benefits of making this just a great community to live and to work and building and bringing communities even closer together. Add to this commitment the fact that the community has put in its own dollars and has decided to fund these efforts, that other philanthropy and philanthropic groups are investing their dollars in support of this work, the strong leadership that you've got from a mayor and a team and city council who are committed to this work, and we felt like this was a great place to be able to put our dollars. So, now for the punchline. The Blue Cross and Blue Shield of Louisiana Foundation is proud to announce our commitment to the Ruston community to invest up to $1 million in support of this community's active transportation efforts in the years to come. You'll be seeing a number of new trails, as you heard, and we intend to be here alongside you, learning, growing, supporting in any way we can. We're also going to be contracting with a number of researchers at Louisiana Tech to evaluate and to understand the positive impacts that this can have on active transportation and people's health. So we're committed to the fact that we can make this investment today, but hopefully this can also become a model for other Louisiana communities and what they can do to improve their health. So on behalf of the Board of Directors, the Blue Cross and Blue Shield of Louisiana Foundation, and folks throughout the state of Louisiana who are looking for models of what we can do to improve our public health, I just want to say thank you to you all for this great planning, this thoughtful effort. We are proud to partner with you and excited for all that is to come. So thank you very much.
I'd like to say thank you, Mayor Walker and Mr. Tipton, for having the courage to acknowledge the work that needs to be done here in Ruston and in my neighborhood. I trust you all noticed on your way here today where there are sidewalks, they're in poor shape and they're unsafe. Much of Ruston's population is living in poverty. Many folks are physically inactive and suffer from health-related problems. The city's transportation system is extremely automotive. These issues negatively affect the entire community, especially the African American community, almost half of Ruston. Poverty plus poor health plus automobile dependency only restrict access to jobs, education, health care, and other everyday needs. Today, the city of Ruston, with the support of the Blue Cross Blue Shield Foundations of Louisiana, have taken a huge step towards addressing these matters. The Rock Island Greenway and the foundation-funded connectors will dramatically improve health for this neighborhood and the entire community by building safe and pleasant routes to walk and bike around town, thereby connecting neighbors and neighborhoods, employees and businesses, children and schools, parks, health care, child care, jobs, social problems, support services, churches, and on and on. Most importantly, these new routes will pass directly through some of the city's most underserved neighborhoods, in which many residents, including students from the Louisiana Blind Center, don't have cars and have to walk and bike for transportation. Again, thank you, Mayor Walker and Mr. Tipton, for showing your support as we begin a new chapter in the south side of Ruston. Again, thank you all, and may God continue to bless you.
Now we're going to count to 1, 2, 3.
Thank
Be
you.
ready on 3. 1, 2, 3.
Good job, man.
Thank you.
Thank you. Thanks everyone for being here. Please hang around, have some coffee.
The cycling community has a central location that we meet up, and it is difficult depending on where you're coming from. A lot of us live inside the city limits, so to get out is it can be dangerous, and not to mention just a hassle, because here we are, the light's turning yellow and we're split, and now it's like, do we run the red light and break the law, or do we continue, so it's just it's going to be nice having that passageway to where it just eases our transportation out of the city limits so that we can enjoy our ride.
Well,
He's got something too.
yeah, I think besides the social and community issues, it's also environmental. The more we ride our bikes and cut down on on exhaust fumes from cars and things, it all helps environmentally, and I think that all cyclists feel very strongly about that too.
And having a safe place to do that is important. Right? Can't save the planet if you've been run over by a car.
Well, I think we all need to be healthier. I know I do. I need to exercise more, and this gives you a really nice place to ride a bicycle, to walk. I mean, we see families out here walking. We see mothers with their kids in strollers walking this greenway, so it's really helpful for our entire city to get more active and to be more healthy.
We've got this nice north-south connector, but we didn't have any way for the neighborhoods, which were further away from the trail, those neighborhoods not immediately adjacent to the trail, to safely connect with the trail. And so I started to look at Ruston, understand some of the symptoms of being an automobile-dependent culture, understanding some of the socio-economic and health effects, the negative effects of being an automobile-dependent culture. And it became apparent to me that there was an immediate opportunity to improve the quality of life in several factors, socially, economically, and most importantly, health.
You know, I think there's several things. One, the fact that the Blue Cross Blue Shield Foundation, housed in Baton Rouge, saw a need here in Ruston and provided this funding is huge. But I think the main thing is that the city of Ruston cares about their entire community, all aspects of it, north, south, east, west, and try to provide a better place to live and a better quality of life while they're here.
I think so much of health across the country and here in the state of Louisiana is driven by what we do day in and day out. And when there are healthy and easy ways to get from place A to place B, as opposed to hopping in our car to just be able to walk or bike the last mile, those are certainly ways that we can improve public health. And providing the infrastructure to do that is certainly a necessary first step. And so the fact that Ruston had such a thoughtful plan that they'd already put together, we were just proud to be able to invest some dollars to make that dream a reality.
It became apparent to me that there were other entities, other people, other foundations that were perplexed by the same problem and had capacity to help solve that problem. And very fortuitously, we were able to establish a relationship with the Blue Cross Blue Shield Foundation. They understand intuitively of the societal benefits of active transportation infrastructure, and they too were perplexed about how to associate what we understand to be the positive health outcomes with the building of the infrastructure. And so there's an opportunity for us to really prove the hypothesis that active transportation infrastructure plus regular usage equals decrease of disease states associated with chronic inactivity. So that's the challenge at hand. And Blue Cross is rising to the challenge. The city of Ruston and the citizens of Ruston are rising to the challenge, and that's why we're here today.
This is absolutely something that other communities can emulate and something we'd like to see them emulate. At the Blue Cross Foundation, we have what are called collective impact grants, which are grants designed to encourage communities to work together to solve some of their biggest health and quality of life issues. And what we think is that communities across Louisiana are looking at the issues that they see, be it obesity, diabetes, hypertension, or any number of other issues, and are looking at those needs, and they know locally the best ways to go about addressing their concerns and their questions. And so whether it's this model with biking and walking or other creative approaches, we're interested in having those conversations and would certainly encourage anybody in Louisiana who's looking for a good model to look here to Ruston for what they're doing to encourage healthy, active transportation.
Blue Cross Blue Shield funded connectors to the Rock Island Greenway run through the heart of the most underserved, the most often forgotten about, really the most neglected part of Ruston, Louisiana. We are in this particular census tract is virtually 100% African American. The median income in this neighborhood is less than $17,000. So if there's a community anywhere in North Louisiana that deserves an opportunity to safely walk and bike where they want to go, it's these folks, it's this community.
People are important, and we should be concerned about their safety and their health. Because if you don't have good health, that means you don't have anything. Once your health is gone, you have no quality of life. So we feel if we can get you up, movable, and a safe place to walk, we can maybe decrease some of the medical problems that we have and decrease our medical bills.
I think I want people to remember a few things. One, that the City of Ruston has done some really thoughtful, good long-term planning on what it means to encourage healthy, active transportation. I also want folks to remember that at the Blue Cross and Blue Shield of Louisiana Foundation, we're committed to improving the wellness and well-being of people in Louisiana. And where there are good plans that have clear outcomes that we can be a partner in investing some dollars on behalf of, we are certainly happy to do so. And we see great things in the future here in Ruston.
Blue Cross Blue Shield and the City of Ruston, Louisiana are taking it a step further. We're building dedicated active transportation infrastructure that will establish a safe route for the Louisiana Center for the Blind, so that those students who walk a mile every morning, a mile every evening, have a safe route to do so.
People can find out more about the Blue Cross and Blue Shield of Louisiana Foundation at our website, www.bcbslafoundation.org, or they can visit the City of Ruston's website to find out more specifically about this effort and a number of the other extensions that will be built in the months to come.